Good afternoon, everyone. My name is Sean McNair, and I will be sharing a pre-recorded session to discuss the topic of burnout. I'll be discussing this topic with two speakers who've been engaging in research on this topic. I have with me Edna Garcia, the Director of Scientific Engagement and Research for the American Society of Clinical Pathology. She works in the DC office. And I also have Dr. Lotte Mulder, the Director of Leadership and Empowerment of the American Society of Clinical Pathology, who works out of the Chicago office. I'm happy to have them here to answer a few questions in this Zoomcast format to inform the cytology community of the work that the ASCP has been doing on the topic of burnout. Thank you, Edna and Lotte, for joining me.
Thank you, Sean.
Excited to be here.
Thank you, thank you. So to start, I'm going to ask the first question for both of you. Would you mind discussing the origins of this research? That is, what factors led ASCP leadership to initiate this survey?
I can actually start with that, Sean. This is Edna. And since we are located here in the DC office, we have the opportunity to attend various meetings, specifically workforce-related meetings at the Hill, or the ones held by, for example, National Academies or Health Affairs. And back in 2018, while attending these meetings, the main topic that was being covered was the well-being of physicians. It was the hot topic at the time. And from these meetings, we learned that there have been plenty of research being done on physicians, nurses, and other allied health workforce's well-being, which includes burnout, but there's no standalone studies being discussed on laboratory personnel, which we thought is an important part of the healthcare team and should be included in the conversation. So we asked ourselves, why are we not, why are there not a lot of data or discussions around lab professionals? So we did lit search to see if there's published literature on wellness or burnout in the field, and we didn't really find a lot. For the pathologist data were included under the physician report, so they don't have their standalone report either. We also found that peer-reviewed articles for lab professionals go all the way back in the 80s, and it's really kind of dated. And we didn't really find any for pathology residents. So that's how it all started. We drafted a research proposal that was reviewed by our chief officer, Jeff Jacobs, and the Commission on Science, Technology, and Policy approved the proposal. And from there, after its publication, conversations about burnout in the lab has grown. And Dr. Mulder can talk about the current burnout survey that she is spearheading. Lotte?
Yes, I'm here. So after the success of the study that Edna described, we ended up putting out multiple educational courses and offerings through ASCP, including at our annual meetings, and through our podcast, Inside the Lab. And the burnout episode that we had is actually the second highest, or the one episode that is second most often downloaded. So all of that really indicated to us how important of an issue burnout is. And so we ended up deploying a short survey back in August of this year, with some questions about burnout specifically related to COVID, because as the study that Edna described was done in 2018, so prior to this entire pandemic. And we had suspicions that, of course, for anybody who has been working through the pandemic the last 2 years almost, that the number of instances of burnout had significantly increased in the last 2 years. So we launched a survey, and within 1 week, we got 2,600 responses. So this just, again, confirmed what an important and crucial topic this is, which is really why we are relaunching the survey again in January of next year.
Wonderful, thank you too. Could you two speak briefly on defining burnout in the context of the work we do as a laboratory professional? That is, what unique challenges did you discover from lab professionals in your research?
Yeah, so we really go by the standard definition of burnout, which means that people have feelings of energy depletion or exhaustion and or an increased mental distance from one's job, or feelings of negativism or cynicism related to one's job, and or a reduced professional efficacy. So in short, and really also to explain the difference between burnout and stress and how those two are related, stress is really the notion of too much. So having too much work to do, too many deadlines, while burnout is really the notion of not enough or too little. So burnout is really characterized by not having enough energy, enough stamina, enough motivation. So when we looked at burnout here in August 2021, we had, so the majority of our respondents, those 2,600 respondents that I mentioned, the majority were laboratory professionals, almost 2,300 actually. So of those, 52%, almost 53% experienced burnout in the past and in the present. And almost 24% experienced burnout in the present, but not the past. So regardless, these numbers are really, really high. Then if we look at our pathologists who answered the survey, 46% experienced burnout in the past and in the present, and 13% in the experiences burnout in the present, but not the past. Then when we looked specifically at if burnout was either caused or worsened by the pandemic, laboratory professionals, 21% said that it was caused by the pandemic, but 51% said it was worsened by the pandemic. And for pathologists, 10% said it was caused by the pandemic and 30% said it was worsened. So all of this is to say that clearly the pandemic has had a tremendous impact on the laboratory field. And it's just really important for us to address that, one, for the future pipeline, and honestly, the current pipeline and to the current workforce, and to really create organizational cultures of wellness where not only are we able to overcome burnout when it's happening, but really to prevent it from occurring at all.
Extremely relevant and important findings. Edna, what did you uniquely find in your observations?
I think I echo what Dr. Mulder just said. The data that they collected from this most current burnout study echoes what we had in the first study, and except that it appears that the burnout is higher this time because it already existed before the pandemic and it's been exacerbated by the pandemic.
Thank you so much, you two, for that. And the next question I have is, would you please openly speak on the potential impacts this has to recruitment and retention of laboratory professionals?
So as you know, Sean, we've been doing workforce research since I got on board. The oldest manuscript I saw was from '88. So we have these trends that there has been issues on recruitment and retention. And I think that the wellness burnout topic tie into the staffing concerns, in that stress and burnout will increase the number of lab personnel who are dissatisfied with their work and will think more about leaving the lab or the field entirely. And echoing what Dr. Mulder mentioned earlier, the pandemic also had a significant effect on staffing, workload, as well as work-life balance of many lab professionals. Even though it put us on the spotlight, many labs around in the past 2 years have experienced furloughs. There were layoffs, lab professionals leaving the field altogether. And what I've been hearing a lot is early retirement. Since the pandemic, those who were anticipating to retire, let's say in the next 5 years, just decided, I think it's time for me to just leave, which leaves the field void of lab professionals who have a lot of experience. Academic programs have also experienced closures during the pandemic. And they had to be flexible in creating opportunities for their students to continue their education. And as a result, the increased workload and pressure likely contributed to burnout among the lab workforce just overall. And so, yeah, the pandemic really disrupted the workforce, staffing and stream of incoming graduates. And from our current study with the University of Washington, hopefully everyone will be able to review that. Our data support that developing a comprehensive wellness program that addresses the physical, mental, and emotional being of lab professionals and those in lab training programs must originate and develop at the institutional level.
Thank you so much for that, Edna. I think that's a very, very important point as we think about recruitment and retention of our laboratory professionals, and also taking care of those who are already in the field. So I will actually have one more question for both of you. In general, what sorts of generational and or organizational trends did you observe in this survey? How could we, as a group of educators, prove to be agents of change given the data that you've gathered?
I can begin with that one. One of the things that we noticed in terms of organizational impact on burnout was that close to 77% of laboratory staff indicated that they were overworked. And this is a huge amount. It may not come as a surprise to any of you, but clearly it is indicative of a potential crisis that is occurring right now. And then, of course, for the future as well. And then more specifically, looking at organizational factors that contributed to burnout, we saw a lot related to increased workload, which of course is also COVID related. COVID-19 itself was also very frequently mentioned, about 55% at the time, but also poor management culture and a toxic work environment. Both came up 50 to around 30% in both laboratory professionals and pathologists mentioned toxic work environment. So that is really, really high. And that is also something that we may not necessarily relate to burnout right away, but it's also something that can be ameliorated. There's a lot you can do to improve the organizational culture, and there's really no need for our work environments to be toxic. There's no need to have poor management cultures anymore. There's so many resources available that I feel like it might actually be a really good place to start tackling this issue. And then, of course, we also found some relationship between DEI issues and burnout, such as, discrimination, sexism, racism, microaggressions, and even grief and trauma, and just how we really need to create these safe spaces at work for people to be not only be valued and appreciated and of course respected as who they are. We have to create these inclusive and equitable workplaces, but then also we need to create spaces for people to process their grief and trauma. Again, these last 2 years have been very, very disturbing for so many of us on so many different levels. And, as much as maybe we used to think that we could separate our personal life from our professional life, it's really just not, maybe that's not healthy. I mean, even if it is possible, though I don't really believe it is possible, so we really need to create these spaces where we allow employees and ourselves and our staff to really process traumatic events that are impacting how they're feeling, that are impacting their wellness, and that are impacting their productivity at work. So the more we can create those safe, inclusive, spaces, the better we are all off.
Thank you, Lotte. I believe transformational leadership is definitely important to mitigate this issue. Edna, what were your observations from this, from your research?
From the original research, we did also see significant differences in job stress, job satisfaction, stress, and burnout, as well as work-life balance by age, gender, and length of time working in the lab. And so just to point out a data point, we found that those who reported having felt burnout as a lab professional were highest among lab professionals who are ages 35 and 44. And so as an institution, maybe they, we encourage them to use this data and create targeted interventions. And, your follow-up question, how you and other groups of educators can be agents of change. I would say to use the data as a tool to advocate for the profession, number one. Dr. Mulder also created the course on burnout. Encourage your colleagues to look at the course and participate in that. We also developed from these studies a negotiation toolkit to help laboratory professionals advocate for themselves, inform them that these are available. From our study with the University of Washington, the results suggest that there is an opportunity to leverage the spotlight on the lab to cultivate the future of the profession as a whole, as well as the individual specialties, especially during the pandemic. And this includes promoting and advocating comprehensive wellness programs for lab professionals within your institution. I recall that one of the results in our first study are lab professionals saying that, yes, they do have a wellness program, but it's just like, let's say, a free gym membership or just discount on a gym membership. That's not enough. It has to be comprehensive and tailored based on the research that that is out there specifically for the field, and also look at the other allied health professions and see what their institutions offer, and from there start the conversation on developing a targeted wellness program, because the only way to address the current and future needs of the lab is for numerous groups of stakeholders at all levels to come together, and that includes lab employers, lab training programs, healthcare executives, and hospital administrators, as well as professional organizations. So that's my take on the follow-up question.
Thank you so much for that. I think that you've really hammered home the point that we have to do more than, kind of like the bare minimum to address this issue, and really target it towards our community to be sure that we're hearing their voices and not just kind of offering researches that are so separated from the actual lab. I thank you to both. That actually concludes the questions that I had for this brief introduction. And I do believe that the conversation that will ensue with our educators will be extremely important, as we would want our students to recognize, we're definitely paying attention to your well-being and your complete well-being, not just pushing you through programs and getting you into places where, you as a person may need to be focused on and also, nurtured so that you can grow and so that laboratories can essentially meet their aims. So I thank you both. And this has been wonderful. Thank you so much for your time. And I'm excited to actually present this at the meeting. Thank you both.
Thank you, Sean.
Thank you.
You are more than welcome.